Hello everyone, welcome back to the question answer discussion session of Sedu Satsavi tutorials. Today's question is related to antifungal drug, and the question is, which of the following antifungal drug is an imidazole derivative? Which of the following antifungal drug is an imidazole derivative? A choice, ketoconazole; B choice, fluconazole; C choice, itraconazole; and D choice, posaconazole. So if you look at the choice, all these drugs ends with the name azole, ketoconazole, azole, azole. All these drugs ends with the name azole. So what are these azoles? So the derivatives of this azoles are widely used as antifungal drugs, and they are nothing but they are 5-membered rings. They are 5-membered rings, heterocyclic rings containing nitrogen atoms. So they are nothing but they are 5-membered heterocyclic rings containing nitrogen atoms, and they are extensively used as antifungal drugs. So we can classify these azoles into different categories, out of which I will explain 2 categories here. So some of the azoles contain 2 nitrogen atoms at the alternative position, and they are called as imidazoles. They are called as imidazoles. If it contains 2 nitrogen atoms at the alternative position, that is the first and the third position, that is called as the imidazole. Whereas if it contains 3 nitrogen atoms, that is called as triazoles. The name tri indicates 3 nitrogen atoms. So these are the 2 different important categories of azoles, imidazoles and triazoles. And the derivatives of imidazoles and the triazoles are extensively used as antifungal drugs. Now we should know which are the drugs belonging to imidazole derivative category and which are the drugs belonging to triazole derivative category. Okay, so you can remember from this mnemonics: C-O-M-E-K. C-O-M-E-K. C stands for clotrimazole. O stands for oxyconazole. M stands for miconazole. E stands for iconazole. And K stands for ketoconazole. So all these drugs, remember this COM-K, this is the mnemonics, and they belong to the imidazole derivative, and they are extensively used as antifungal drugs. Clotrimazole, oxyconazole, miconazole, iconazole, and ketoconazole, they belongs to the imidazole derivative, and they contain 2 nitrogen atoms at the alternative position. Whereas the triazoles, which contains 3 nitrogen atoms, the examples of drugs include, you can remember from this mnemonic, flu, VIP. Flu indicates fluconazole. V stands for voriconazole. I stands for itraconazole. There is one more drug which starts with I, that is called as isavuconazole. Isavuconazole. We have discussed this drug in our previous video. Yesterday's video, we have discussed this drug, isavuconazole. And P stands for posaconazole. Okay. So all this drug, flu VIP, remember the mnemonic flu VIP, fluconazole, voriconazole, itraconazole, isavuconazole, and posaconazole belongs to the triazole category, whereas COM-K belongs to the imidazole category of drugs. Okay, so the answer to this question, which of the following antifungal drug is an imidazole derivative? Ketoconazole belongs to imidazole category. Fluconazole belongs to triazole category. Itraconazole belongs to triazole category. Posaconazole belongs to triazole category. So the answer to this question is A choice, ketoconazole. And one more thing you should remember, out of these azole derivatives, okay, we have explain the different drugs coming under the azole category. Out of this, the different azole drugs, only 2 drugs, that is isavuconazole and posaconazole, are the only 2 drugs which is effective against black fungus infection. We have explained this thing in the yesterday's video, so do watch those video. So these are the only 2 azole derivatives out of all these drugs. The only 2 azole drugs which are effective against the black fungus infection or mucormycosis include isavuconazole and posaconazole, whereas all these drugs, they are not effective against black fungus infection or mucormycosis. Isavuconazole and posaconazole are the only 2 azole drugs which are effective against black fungus infection. So hope you understood this discussion session. Thanks for supporting us. Keep on watching our videos. Please share with your friends. And if you're watching it for the first time, please do subscribe to our channel and click the bell icon for our daily updates. Meet you again with a new video. Stay safe. Bye-bye.